Happy birthday. Thank you, Dad. Thank you.
You remember that moment? 100 days ago, in fact, nurse Maritza Benitez received the COVID-19 vaccine at University Hospital in Newark. It was the first vaccination in the Garden State, in fact.
So joining us now to give us the latest on how things have been going so far is President and CEO of University Hospital, Dr. Shereef Elnahal. Welcome back, Dr. Elnahal. Thanks for being here.
Thanks for having me.
So let's get into it. Since the first vaccination, let me ask you a twofold question here. How has New Jersey been doing with distributing the vaccines, and is there enough supply?
Well, New Jersey is doing better and better with the efficiency of actually administering the vaccines. We're consistently in the top 10 of states across the country in efficient dose use, which means for the dose that we're getting, how much of we're actually delivering in arms within a span of about 2 weeks or so. And that number is quite high. And again, we're in the top 10. That said, we haven't vaccinated enough people yet in New Jersey or really across the country. Still less than 20% of folks are fully vaccinated. So we're not going to see the effects on hopefully decreasing cases until we get to 50, 60, 70% fully vaccinated.
I want to zero in on what you were just talking about, because despite millions of people in New Jersey that have gotten the vaccine, cases, as you just mentioned, are on the rise in the state. What is behind that?
Well, it could be a couple of things. First of all, we do have a number of variants in New Jersey confirmed, detected. We don't know what exactly the prevalence is because we don't test often enough for the presence of these variants. That said, we know that they're here, and we know that cities like Newark, what University Hospital serves, and our community here are more vulnerable than the rest of the state because of how dense we are and a number of other factors. So if we have variants, they're likely in Newark, and that's why we're starting to see cases in our hospital most likely.
But knowing that there is a number of variants now, not only in New Jersey, but across the country, why not increase the testing for variants so you have a better understanding of where we are with them?
That's definitely the intention, but it's not as easy as it sounds. First of all, you have to expand something called genomic sequencing, which is a complex, often 3, 4, 5-day process for every test sample. So that's why we're not able to sequence as much as we'd like. Now we're trying to innovate and see if that can be done faster, but we hope to be able to start sequencing more and more over time.
Understood.
I want to get your opinion on this because you talk about the variants increasing in Newark specifically. You have the Newark mayor talking about everyone, not just essential workers, but everyone in Newark needing to get the vaccine, and now. He's saying it's, you know, the urgency is right here and right now. Should that be happening? Because I know that we have, you know, a standard protocol, this group, then this group, then this group. But he's saying, blow that up. We need Newark residents vaccinated right now.
I understand where he's coming from. First of all, less than 5% of people in Newark are fully vaccinated. That's well shy of the state's level of greater than 15% at this point. So he's speaking from a place where he wants his residents in Newark protected. And we're starting to see increasing cases at University Hospital. So I think where he's coming from is quite valid. We're going to see a spike in supply, hopefully, in the coming weeks as of mid to late April. And by May 1st, the president has already said, I want every eligible adult to be eligible for vaccination by May 1st. So I think he's coming from a good place there.
Curious about the increase in cases you speak of. From those cases, that increase in hospitalizations, have any of those folks been vaccinated?
We haven't seen a single person vaccinated admitted to our hospital with COVID-19. And that is the same as the trial data, which is really impressive. And it just underscores how all 3 vaccines are so effective.
Right.
And that's important information. And let me ask you about Governor Murphy. He says that he wants to pause reopening plans because of the current COVID-19 caseload. Do you think that suggestion is justified? Do you support that?
I think it's the right move. We are not anywhere, we're close to the finish line, but we certainly have not crossed it. We need to vaccinate many more people in the state first, and you have to follow the data when it comes to case trends and hospitalizations. And unfortunately, in New Jersey, you're seeing both go in the wrong direction. So you've seen some more relaxed restrictions that he's put forward over the last couple of weeks. He's not taking those back. He's just simply pausing on further restrictions. And I think that's entirely appropriate.
You know, I want to talk about what we just discussed in our previous report with our Kirsten Cole, and that was what Rutgers University is looking to do now, requiring that every student be vaccinated to return to campus. Given the proximity of where Rutgers is, they have a campus in New Brunswick. They also have one in Newark, right near your hospital. What are your thoughts on this? Because it's really one of the first kinds in the nation.
Well, I think it's a bold move, and I think it's the right move. We saw universities be one of the most important niduses of spread of this virus across the country. And also, as I've been telling you that we're seeing increased admissions, we're starting to see younger demographic groups being admitted because older folks tend to be vaccinated more these days and will be vaccinated even more over the coming weeks. So this virus does not spare folks. I know that it's worse in terms of outcomes for older folks, but we are starting to see younger demographic groups come in. And so for both the safety of the professors and faculty, but also the students, I think it's the right move.
But doesn't that then go to kind of what Betty's point was earlier, right? If you know that college students are going back to school in the fall, why not make them eligible for the vaccine to keep those campuses safe and secure for not only the students, but the staff?
Well, so to be clear, they're talking about the fall semester, and by then, hopefully we'll have more than enough supply again to vaccinate every eligible adult, and that will include college students.
Understood.
All right, so let's look ahead to another 100 days from now. You're going to close the summer holiday season. Do you think we'll be able to celebrate differently than we did last year? Is this vaccine going to make a big difference?
I hope so, and I'm optimistic that we can meet the president's goal of being able to have 4th of July gatherings responsibly outdoors, but with your loved ones, family, and friends by July 4th, if we get enough people vaccinated. So that's why I know he's done everything he can from Washington to increase vaccine supply. States like New Jersey are accelerating as much as they can to administer it. I do think that goal is achievable, and I hope we can get there.
Dr. Elnahal, always appreciate your voice and explanation. It's so clear to understand your points. So thank you very much for coming on.
Thanks for breaking it down for us. We appreciate it.
Thanks again. No problem.